The cool thing about painting is there's not a lot going through my mind. Painting is a way to relax and disconnect and just try to make something pretty. I am a 63-year-old woman who lives here in Baton Rouge. I have 3 children. I am a healthcare consultant that travels for a living, and I was diagnosed with breast cancer back in October of 2024. I never cried, and I had not told my mom until after the diagnosis. Now I'm gonna cry, because I didn't want her to worry unnecessarily. The nurse navigator called me and she told me that Dr. Brooks was gonna be my oncologist. I was so happy, because I've known Dr. Brooks for a very long time and I trust him as a physician. Hang on.
What I always tell employees and friends who I've cared for, nearly 40 years here in the Ochsner Baton Rouge region is I love to see you as a friend and a colleague, but I hate to see you as a patient. It's probably one of the most stressful things I do, is to be able to take care of friends and colleagues. I do take it as an honor, and I know they trust me, and I am providing them with the best care that I can offer them and that I would want for my family members. Integrative Oncology is a program where we try to treat the entire person. Try to treat the symptoms that they're having at this point in their life, from their disease, from the treatments for the disease, and to try to have them develop a more healthy lifestyle to try to prevent second cancers.
The whole integrated oncology program, the nurse navigator set me up to meet with the occupational therapist, and I met with her pre-surgery. And she really helped me understand even more about what was going to happen to my body.
I'm going to hold the center. Okay. And you're going to pull back into, remember our rows that we used to do? Mm-hmm. Okay, good.
Integrative approach and a multidisciplinary approach is extremely important to these patients. We're not just treating the cancer, we're treating the person. And so we're trying to make the person whole and get rid of the cancer in the process.
It was great having that resource to help with lymphatic drainage and scar tissue, having access to acupuncture. Never even thought about it as an option. That has been a blessing. It's so important for women to get their regularly scheduled mammograms and do their self-exams too, because this one was too small to be felt by self-exam. So if I had not had my mammogram, I wouldn't have found it.
The Ochsner MD Anderson partnership has been an incredible tool and a tremendous impetus for us to even bring this to the next level. We have a tremendous peer-to-peer arrangement with MD Anderson where if I have a question, I call one of the experts. Those are tremendous tools that we offer our patients.
Cancer, I was very lucky that it wasn't a life and death situation, but it's mentally devastating. And it's never gone. It's always on your mind. I think I learned that I need to take time, and that life is more than just work, and that my value is more than just my professional value. The value I bring to my family and to my friends and coworkers from a personal standpoint